consent to be live streamed. Anyone who
sorry, Dolly. Yeah, it's gone live stream now. Did you want to?
Yeah, that's what it went on. I was like, what happened? Yeah, so I got approved. So I wanted to let you guys know that. So I get to see,
You're
get
muted,
my eyes
Dolly.
done. Yeah, I got my eyes to get my eye examined. I was like, thank goodness, because I was having issue with my eyes too, and then I'm like, then they can't see you, and you cannot pay out of your own pocket. And some people that I know, they're allowed to pay out of their own pocket, or they'd be doing it before.
So I think what we'll do is let's start the meeting, and then we'll address all those questions.
Okay, no problem.
So we are live now. Okay. Hi, everyone. Apologies for the technical difficulties. I hope everyone's doing well. This is Dolly Begum, your MPP for Scarborough Southwest. We were just actually having a really good conversation because as we're trying to fix the technical difficulties, we wanted to get the ball rolling and have a conversation. So to those of you who are joining us live on social media, thank you so much for tuning in, and please feel free to leave a comment and ask any questions. Today, I'm very lucky to have two wonderful doctors with me who will be answering some of your questions, and we'll have a discussion, as well as community members from Scarborough Southwest who have been sharing their concerns and what they have gone through. So I want to quickly introduce, I have the owner and neurovisual optometrist, Dr. Kieran Ramesh, with us today. Thank you, Dr. Ramesh. Thank you so much for everything that you do for our community, and thank you for joining us this evening. I also have Dr. Ray Teixeira, who's also a neurovisual optometrist and someone also in Scarborough Southwest, both part of the Vision Care eye clinic, and we're very, very. Did I say that right? It's a Vision Care
Center.
Vision Care Center. And both are in Scarborough Southwest, and we're very lucky to have a wonderful center that focuses on really, I think, the therapeutic part of it, and helping children, helping adults, and focusing on how to have a quality of care, quality of eye care. So I'm really excited to have this live conversation. I also want to thank all the community members who have joined us this evening, especially some of the participants that we're going to hear from today, including Alice Shuda. We have Amy, we have Joe Ferret, Judith, and Monique, as well as Paul, and I believe, if I could get my screen ready so I could see everybody. All right, so for those, I think I covered everyone. And then obviously those of you who are joining us on YouTube or on Facebook, please feel free to leave a comment, and we'll make sure to, we'll try our best to answer your questions. If we can't during this live session, we will be happy to respond to you or connect with you at a later point. So just to give you a little bit of a background in terms of what's happening right now. As many of you know, and I know many of you are aware of this because as I attended a lot of events during this weekend, I heard about this. The government right now is negotiating with the Ontario Association of Optometrists. And a little bit of background in terms of what has happened, because this is not new. And I remember, Dr. Ramesh, we were talking about this about a year ago. The past summer, the optometrists were raising this concern, and it's been months and months where we wanted to have this negotiation done so that we don't hit this point. But due to the government's lack of action during the negotiation process with the OAO, the Ontario Association of Optometrists, this past summer, access to eye care has been denied to individuals under the age of 20 and above the age of 65 years of age. And it has escalated to a point now where we have about 280,000 people across the province whose eye appointments have been canceled. And some of the folks who have joined us today are included in that number, and will be able to share what impact that has on their children or their or themselves or their parents. And I think just to kind of go back a little bit of why this is so important and why we are at, this negotiation process. And I think the conversation we're going to have today, it's important to look back a little bit. For about 30 years, or over 30 years, the Ontario government has refused to formally negotiate with optometrists. And this is so important to highlight, because if you look at other provinces, they have a much better deal and much better system for or at least the importance that we give to eye care. In 1989, the Ontario government paid $39.15 for an eye exam. $39.15, that was 1989. In 2021, 32 years later, they pay an average of $44.65, which is the lowest in terms of the provincial numbers when we look at across Canada. And right now, where we are is about 8% that the government has offered. And we'll go, and I'll pass it off to the two doctors that we have today to talk a little bit about this. So I wanted to give you guys this background because it really sets the tone for why this negotiation is important, why we were out there in front of Queen's Park just a few days ago, fighting for sight, fighting for eye care. We had students who were going to be optometrists, who walked into a field that thinking that, their profession is going to be something that's valued. And now the government is not willing to negotiate. So a lot of people are out there, a lot of individuals whose care has been affected. Right now, we're here because we want to talk about this, So without further ado, I'll hand it over to Dr. Ramesh to give us a little bit of what you do and how you're seeing your clients impacted as well, and anything else that you want to include.
Yeah, absolutely. And I think, first of all, thank you so much for being here or asking us to be here. And thank you so much for always supporting us, because as you said, Dolly and I had a conversation, I think March 2021, as we were talking about what was going to happen. So as she said, this has been an ongoing process. I don't even know if I would call it a negotiation, because there was 8 months of silence from the government. So they were well aware of all of this, and they refused to speak to the Ontario Association of Optometrists. So they knew September 1st was our deadline. They did call us on August 5th, and we had a 2-hour meeting with them, at which point they decided that we were going to have mediators. And so during that process, we had a 2-day mediation. And what came of it was, we're too far apart in terms of what the optometrists want and what the government's willing to provide. And so we were going to suspend negotiations temporarily until we could discuss anything further. And yet they knew September 1st was still going to happen. However, Christine Elliott breached the confidentiality agreement of what happens during mediation, released to the media what they were going to present to us without even offering that to us during mediation. And so now it looks like, wait a minute, they're offering us all this stuff. And when you break it down, it really doesn't amount to anything. And we can go into those details, but they're offering, and they are back paying taxpayers' money, and they're using that. They're even paying retired optometrists that have already passed away. And so, it's all the funding that could have been used to really help support what needs to happen, which is all we're asking is to pay the bare minimum of what it costs for us to cover our expenses. And when we say our expenses, meaning the rent dedicated to seeing an actual eye exam, an eye service. So not even selling glasses, not even anything else that's retail related, only to see a patient. The cost of that rental space, the cost of staff, we just want the bare minimum covered. So not even to make a profit from it. And that being said, the cost analysis on that is about $80 for an exam. And like Dolly said, we're getting paid about 44 or something, 43, like it's peanuts. And we are across Canada, we're about 65% below the lowest paid province. And so when you're looking at Ontario and you're looking at the population, you compare us to someone like Alberta or BC or Quebec, where we should be. I mean, it's quite sad because we're comparing ourselves to Manitoba, which is 65%. We're still 65% below. So that's what the thing is in terms of what we're doing and not seeing patients. I mean, as I was saying before we went live, like we had, and Dr. Teixeira can say this, and one of our other associates, Dr. Sebastian, we had to have an emergency meeting because for us, it was very difficult to make this choice. I'm a mom, I have children, and I thought to myself, like, if I needed my kids seen, like what would I do, you know? And I have parents, I have grandparents, like it breaks my heart because, you know, when you are a professional, part of what you do is to make sure you see your patients. That it's just ethical, and absolutely, we don't want anyone to be hurt. But people don't value sight. People think it's important to see your dentist. I mean, if I lost a tooth and if I lost my vision, I mean, hello, I know what I would choose. So yeah, we need to bring more value to what our profession is worth. And yeah, it was a very difficult decision. What we do, and when patients do call, is we ensure that we put them on a list as soon as things are resolved with the government. You know, you're going to get a card so that you can get called in, or, you know, you'll get an email. Or you can directly call in so we can get you in as quick as possible. If it looks like there's a sight threatening issue, absolutely, we triage you to either emerge or you go see your GP, and we will recommend which ophthalmologist we want you to see. So you don't go in there blindsided as, I don't know what to do. We can tell you exactly who to ask for and who to see. And our ophthalmology community is supporting us. Even the opticians, we've got industry supporting us, students, as you said. So yeah, that's what we're trying to do to try and make it easier. I mean, you know, the best that we can ask for from all of you is to really push to the government, go speak to the Conservative MPPs, go call Doug Ford. I would love to just, you know, make that government feel like your child, make that government feel like your grandfather, make that government feel like anyone who's struggling with vision so they can really understand what it's worth.
Thank you so much, Dr. Ramesh, for that. And I know from the participants who have joined us as well, some of the questions are about how the framing has taken place. And I think it's really, really important. And I want to thank some of the participants who have talked about the importance of eye care. And I'm getting personal messages as well about how eye care has always been seen as a separate part of the rest of healthcare, just like dental care, as if teeth and eyes are not something that affects our health. And it's really, really a shame that we have not reached that far in 2021. We should be able to invest in eye care and invest in a holistic model of healthcare that helps people, because the cost of not supporting eye care, just like dental care, for example, is actually really significant in our healthcare system, because at the end, people end up in the hospital, in the emergency rooms, and it can affect their overall health, and that can have a huge cost, especially when we look at the cost of a bed per night.
Yeah, and if you actually look at the numbers for that, for the amount, so in terms of how much importance we're putting on eye care, so the government meets with the OMA, which is the Ontario Medical Association, every 4 years. With optometrists, they haven't met with us in 30 years. And in terms of what percentage is actually put towards optometry from the healthcare on a $71 billion health budget, we get 0.2%. And all we're asking for is 0.4. So it's a 0.2% increase that we're asking for. Yeah. And it's just, you know, it's sad because we don't put the importance on that.
Yeah, and thank you for that number, because that actually puts the whole system into perspective, because I think that's what the government is playing on right now when we don't look at the numbers. So one of the things the government has offered is we talked about the 8.49% increase, which is the when we look at the actual cost per eye appointment, for example, and that, so if we want to just give you a breakdown of that, what that really means is an increase of that average payment for an eye exam from $48.43, requiring Ontario optometrists still have to pay more than $27 out of pocket for the eye exam. So even with the 8% increase, they're still having to pay about $27 for an average eye exam out of pocket if they examine an OHIP insured patient. So just to give you guys an idea of what that means when we talk about the 8.49% increase. And what Dr. Ramesh was talking about was the holistic healthcare investment, and what they're asking for is a 0.2% increase.
And that's just to cover the bare minimum. So that's literally only to cover the costs.
Yeah. And it doesn't also make up for the lack of investment that hasn't been made over the past 30 years. So the government, when they talked, they offered a one-time payment, and this is something that I cannot grapple with, because when we talk about government investment, which is one time, they're not really taking into consideration the long-term impact or the long-term success of any program. So the $39 million that they have offered, which is supposed to make up for the underfunding for the last decades, this average is just over $1 per exam for every optometry services performed over the last decade, which really is shameful when you compare to the other provinces.
And to your point, honestly, if it's a waste of taxpayers' money. So if we were a labor union, it would be illegal to do that, because you are paying them off during negotiations.
Yeah.
I think there was 2,200 of us optometrists across Ontario, and I think there was about 2,500 of us have actually signed a letter saying we don't want this money, because this is your taxpayers' money. This money is going to not just the optometrists that are practicing currently. So someone who hasn't, Dr. Teixeira has only been practicing for under a year. So she's getting this, which is fine. But then now there's someone who retired that was at my practice. He's still going to get some, and yet, right? And then now there's people that have passed away. They're going to still get some because they're still in that OHIP system. So this money is going nowhere.
It doesn't really fix the problem that we're facing right now, nor does it look into the investment that we need for future of eye care in the province. Mm-hmm. So I want to go into that, in terms of the people that have contacted our office and how it has impacted. And I know, Dr. Teixeira, you see a lot of patients, and I'm sure a lot of clients' appointments have been canceled. Tell us a little bit about how important it is for us to continue, and what impact you're seeing from your patients and the people that you're hearing from.
Absolutely. So I think the main thing is, our patient load has decreased a ton. But the one thing that we have to also consider is the fact that this past year has been a lot different than many other years. And especially with children, just like Amy was saying, her daughter's back in school and can't see properly at the board. There's so many things that need to be screened for, especially when kids are starting school, that are now being missed. And it's really heartbreaking to think of kids being in school and not being able to learn properly, not being able to take in the information that they're given. That impacts them on so many levels beyond vision. And that just goes to show how important vision is to every aspect of our life, whether it's socializing with friends or learning or playing sports. There's so many things that vision ties into. So that's just one aspect. But even, our senior population or things like that, it's hard because you want to screen for diseases. We're doing a really good job to try and support patients who are having eye emergencies. I think Dr. Ramesh talked about this before, but it's really important to always call your optometrist in your area, your normal optometrist. We're doing our best to try and triage you to someone appropriate to take care of you. The ophthalmologists are supporting us. And we'll try and direct you to get the best care possible, whether that's to the emergency room or to an ophthalmologist or to your general doctor. But that's kind of the best we can do right now. But as Dr. Ramesh said, it's really heartbreaking to not be able to see patients because that's all we've kind of known. So it's different for sure.
Yeah, and to her point, the people that have been calling in are very understanding, but that being said, it's because they don't have issues. Maybe it's just a routine check, right? But the ones that have called and are irate or have it, we are making sure that we are triaging them. So if we're worried, we are making sure we're triaging them. So, I don't know if like any of these other people are experiencing anything different, absolutely, we are here to support you. So if there's questions regarding that, we want to make it absolutely clear what we're here to support you with.
I want to have some of the folks we have in the room to share some of their concerns, because I know I'm seeing some of the comments where people are talking about some of the issues they're personally facing, especially when we talk about young children, a lot of whom just went back to school, and I know there are individual parents who have reached out talking about how they can't even sit in front of the computer, and they need to be able to get their eye exams. They need to be able to go back to classes. So I know Monique and Judith and some of the other folks who have joined as well. Can I open it up to some of you? I'm going to try to see if I could unmute. So I'm going to ask some of you to unmute. And so I see Judith has actually sent a written statement. Maybe I can read that out. Unless Judith, if you're on the call still, if you could, or I can actually, let me see. There we go. Did you want to share? Did you wanna just unmute yourself and tell us some of the things that you shared with us?
Okay, I think I'm unmuted now, right?
Yes, perfect.
Okay,
go ahead.
Good. I'm a senior and have been for a few years now. And in fact, I have been working, increasingly working, because new opportunities are coming to me. I work, first of all, to supplement a very meager government salary or pension. And secondly, because I love working. I'm an actor, I'm a speaker, a workshop leader, a writer, and I do other things as well. I volunteer in the community. I help seniors and immigrants, and I feel that I contribute very well to my community. And I would like to continue doing this. I have not had an eye exam for a year. I know that in the last year, a year ago, I would not have had these glasses on. My vision is deteriorating. And I have a family history of macular degeneration. So far, thank heaven, it hasn't manifested in me. But I need to keep an eye on this. I don't want to have to stop working, which I actually need to do, because of an eye problem. This is not right. This is a sign, a further sign of disrespect to seniors and children who, in our values in this society and in commonly accepted traditions, we care for our elderly and our children, our youth. This is what we do as Canadians, and we cannot tolerate a government who disregards these important values. This is just wrong. I, for one, will be active in this election season, this provincial election, and I really hope that everybody who has been affected by wrong decisions by this government will also be engaged in making their stories known and their displeasure known to voters.
Thank you, Judith. I think I want to comment on two things you said. One, you're absolutely right. Vision is so important. And I don't think people realize that 60 to 80% of what your brain actually does is visual processing, whether that be sight, whether that be how you socialize, or whether that be how you read or how you write or how you feel when you're on the computer. And, you know, considering what just happened in this past year, many people are being forced to, you know, be on a computer, which is not comfortable for them. And that's more than just what you see. It's actually vision. And so, yeah, when it's your brain's processing that much, it is absolutely important. And like you said, you don't want to stop working. And I don't want to stop working. And neither do any of my colleagues. And, you know, it's pretty sad that, even our colleagues, and I know everyone is suffering, it's a pandemic. A lot of people have had to, sort of decide what they're going to do, have some loans, and same thing in our industry. You consider us professionals, you consider us doctors, you consider us with titles, and yet many of our colleagues have had to take out loans and are in fear of whether they're going to be able to continue working. And now these are young people, and this is their future, and this is their career. And so, yeah, I'm in agreement with you. And it breaks my heart, like I said, that you have even gone a year knowing that you have a family history of macular degeneration. But absolutely, I mean, unless we actually make our voice heard to the government, nothing's going to be done. And that even being said, we really need a lot of people to call in, and people need to understand the value of vision.
Thank you
Well,
so much.
the more people who do it, the more possibility that they will turn their decisions around in our favor.
For sure. Yes.
You're absolutely right. With this government, that's the way we have seen everything go, from every single thing, every part of healthcare, autism, support, every single decision they've made. When we push back, when we fight back, they will slowly turn, and they will slowly come back. And
there is power in numbers, right?
Yeah. Judith, thank you so much for that. And thank you. You spoke so beautifully about the importance of that as well. I have Alice next. Alice, thank you so much for joining. You have a question, and can I pass it off to you next?
Sure. First of all, thanks for this town hall, and thanks to everyone who has joined. I've been following this and trying to make sense of it. And I mentioned in the chat the op-ed piece in the Saturday Star, Martin Reg Cohen. And, I have to say, the characterization was like, oh, this is a money grab by optometrists. And so the figures and the stats that you're sharing really go a long way. And I'm wondering, Dolly, if your office or someone can just send out a quick talking points, because I'm totally happy to contact. So I think my question was answered, but just for me, this is in the context of an austerity political project. And so it's a little bit like whack-a-mole. Now it's eye care. Soon it's going to be something else. And so even as we advocate on this particular crisis, I think we have to be aware that the larger issue is putting the brakes on an ongoing and well-financed and fueled austerity program in the province of Ontario that ultimately we are going to be constantly seeing services eroded. System change would be great. Voting is one way to do it, but there are also a lot of other ways to go about unraveling that narrative that, quite honestly, Martin Reg Cohen kind of spouted in his piece. So I guess I don't have a question, but thank you all.
Thank you for that. That was an excellent point. And I think sometimes what the government has done and their message box and the rhetoric they've used, and the minister coming on, in the legislature last week and just continuously repeating that she's ready to negotiate, she's willing, and all of that. What it shows is that it's sort of trying to really change the argument, and just like with the education, they try to put parents against teachers and or educators, and educators against parents. That's the same thing that the government tries to do. And I think what it does is it really takes away from the greater problem. And then obviously a lot of people, and we'll definitely share some of the numbers as well, because when we have a government that's willing to offer $39 million, but it's a one-time payment, and Dr. Ramesh, really frankly put it out there that we don't want that $30 million, that $39 million, because that's not what this is about. This is about investing in eye care in the long run, which we haven't done in the past 30 years. So that really shows, I think, the willingness and as well as the right intention what we want to do and what we want to achieve in our province. Dr. Teixeira, Dr. Ramesh, did you want to reiterate some of the things that we talked about before we started our live when we had our technical glitch in Alice's point, or anything else that you want to share?
Well, I think with what Alice said, we went through the numbers, but with what you just said in terms of, the minister saying, I will do this, I'm ready to negotiate, but it's one thing to say and it's one thing to do. And, considering there was absolute silence right from December 2020 until August 5th, 2021, I mean, that really shows how much you're willing to negotiate. And then in bad faith to break a confidentiality agreement and then put out an offer to the public 2 hours after you've said that you're going to suspend negotiations, again, shows what they say and what they do is completely opposite. Yes. But again, like Alice, I mean, we went through the numbers. They've got a $71 billion healthcare budget, right? And so if 0.2% is to the optometrist, we just want 0.4. And if they're offering that 39 million, put that towards the long term versus a retroactive payment, which is half of that money, or I don't know what percentage of that money is going to people that aren't even working currently. So that doesn't make any sense. If I am paying taxes, I'd be pretty pissed, to be pretty frank. So
sure. Dr. Teixeira, did you want to say anything?
No, I absolutely agree with what Dr. Ramesh was saying. I think the main goal of all of this is to create a sustainable eye care system for the future. So one lump payment, it just doesn't make sense. It's not a sustainable way to do things, in my opinion. So yes, I completely agree with everything that's been said. But I think that being said, it's being projected differently in certain forms of media. So it's good that we're clearing things up today, because I've had a lot of similar questions from patients in our chair. And it's sad because we don't want to be portrayed that way, because that's absolutely not our intention.
Yeah. And just to kind of reiterate one part of it, which is we are seeing the government step back from covering OHIP covered healthcare. And that is a huge problem. One of the I think initial fights we had when after this government came in was just basic OHIP covered things like ultrasound, for example. Like when we talk about like cancer patients getting their results and then finding out what to do. And what happens is when you take away things like examination, taking away ultrasounds or the anesthetic part of that, it delays a lot of people from getting the care they need. And that can have that, going back to the idea of, that it spirals into having more problems in our healthcare system.
For sure. So if you don't have the screening, you don't have the examinations, you don't have the testing, now you're going to be spending way more in healthcare after trying to resolve an issue that could have been 75% of eye disease problems can be prevented.
Yeah.
So now if you're not going to cover that, now you're going to have everyone that has macular degeneration or glaucoma or something else that they're going to need support in, right? Or just like I said with cancer patients. And this is a problem, is no one's looking at the long term. Everyone's got a very myopic view in that government.
For sure. And for a government that talks about math, this is bad math, frankly speaking.
Yeah. I'm pretty sure children could do that math, even though they were in school for 2 years. They could probably still do the math.
I agree with you. I want to get some of the people from our social media who have been asking questions. Unless there is some people who we have in the room, Paul, Amy, anyone else, if you want to ask any questions, please do feel free to unmute or send a message in the chat function. And Maisha, if you want to tell us some of the questions or comments we're getting in Facebook, on our Facebook. I know there are some people who have asked some questions as well on our Facebook page.
Yes, so we have a question from Andrew Clement.
Hi, Andrew.
Andrew, and the comment is, as an optometrist, I'm having a hard time finding new doctors to work for me. We have 80% OHIP patients.
Thank you so much.
And that's what I meant with our colleagues, right? Like Judith said, she wants to continue to work. So how do we get we want to continue to work as well. So he's struggling to have someone come even work for him because 80% of his patient base is seniors. And that should not be the case. People should want to they go to school to be able to, help people with the health of their eye. And we should all be like, oh my goodness, that's a senior population. That's who we want to support. There should be no reason that doctors don't want to work there. But if a doctor coming out of school can't pay off their debt, why are they going to want to work there? That's sad. Absolutely.
Thank you, Andrew, for that. I think the idea that when we talk about OHIP coverage and that the investment that we need in our OHIP coverage, and obviously going back to the number that we're talking about, the amount that the government is willing to invest is so little. It's really shameful. And it's also, and I think Alice talked about this, and Judith actually talked about this as well, how disrespectful it is to our healthcare professionals. So thank you for that. I appreciate the understanding and the questions.
We have another
Go ahead.
We have another comment. It says, it's from Julie Skew. It is ridiculous that the government won't pay. There are homeless people with one eye and they can't get glasses because of this. The poorest are suffering.
Thank you for that. The poorest are always suffering. This is what we find with a country where we should be, our healthcare system is our pride, and we should be investing in that. And I know, Dr. Ramesh, you talked about the percentage. Can I ask you to just tell us a little bit more again, the percentage that's invested in eye care and how much you're asking for?
0.2% is invested, and we're asking for 0.4%.
Yeah.
We're only asking for an additional 0.2%. I really don't know how do you get that message across. I don't think people value their vision, and until something happens, they don't understand. And so, I understand there's so many disciplines, but, it's not something that we're asking for a lot. And it's been 30 years, whereas the OMA is in discussions every 4 years. So.
Yeah. Thank you for that. And Julie, I'm going to also thank you for pointing out what homeless folks, people who are already struggling, are going through. And during this pandemic, we have really seen the impact it has had on people's health, and what this means, as well as the fact that our seniors were treated so badly, and how many lost their lives during this pandemic. And these are the people who are impacted the most when these kind of decisions are delayed, and when we don't respect our healthcare professionals and invest in the way we should. So yes, the poorest and the most vulnerable are the ones that are suffering the most.
We have a question from Mahfuzul Haq. Do we need a visit with our family doctors in person, just if we want to know when we can start in-person visits?
Dr. Tushira or Dr. Ramesh, can I pass that off to you? Do you know what any timeline, or what are you expecting?
To have in-person,
I can try to answer that.
Family doctor?
I think what Mahfuzul Haq is asking for is in terms of, do they need to go to their family doctors in person, just so that we want to start visiting in person? So I'm guessing you're talking, so with family doctors visit, you can, and same with your eye doctors or for your eye examinations, obviously keep in touch with us so that we can let you know in terms of what's happening with the negotiation, so that you can visit for your eye exam. And if you have an emergency, please do contact your family doctor, because I know there are cases where if you need emergency support for your eye, contact your family doctor, let them know what's happening so that they could refer you as soon as possible, because there are some things where you may need to go to the hospital, you may need to go to the emergency room. And Dr. Ramesh,
even call us first, call the optometry office first if it's an eye emergency.
Okay.
And then triage you accordingly. In terms of if your family doctor will see you in person, that we do not know. But we can always guide you on what to say and what to ask for or who to be seen by. And then based on symptoms, they can choose how to correctly direct you. And if that's not meeting your needs, absolutely, if you're worried about your sight, go into Emerge. They will call the on-call ophthalmologist, and then you will be seen by an ophthalmologist.
Thank you. That's a lot clearer than what I was expecting.
I have a few other comments. The next one is from Paulina Corpus.
Hi, Paulina.
The young people in gig economy who are in precarious jobs do not have coverage for eye care and dental care. So that was just a comment from Paulina Corpus.
Thank you so much for that. And Paulina is an advocate in the community as well, fighting for social justice and a lot of people in the gig economy. So absolutely, I think especially a lot of students who are in the gig economy, if they're under 20, they would have been covered for this, who are not. And then for anyone, I think, who do not have eye care coverage or dental care coverage, absolutely, this is something that we need to continue to fight for. And we need to have that included in our healthcare system. So Paulina, we have a lot of work to do, and I know you'll be joining us in that fight for sure.
We have two more comments. The next one is from Terry Harrington Patterson, who said that they need yearly appointments due to retina issue, which turned into a cataract. So if either of you have any advice for folks who need these kinds of regular checkups?
Yeah.
Ray, did you want to reiterate that?
Yeah, so I think what we were saying before, we would absolutely suggest that you get regular eye exams under normal circumstances. Right now, we will support you in the best way possible. If you do have retinal problems or cataracts or anything like that, I advise you to call your optometrist, whether that's us or anyone in your area, and they can try and triage you and send you to the adequate care provider. So whether that is to a retinal surgeon or a cataract surgeon, or maybe for other conditions, we'd refer you to your GP. Definitely call your optometrist and we'll try and triage you accordingly. But yeah, it's very important with things like that to seek regular care. And that's why it breaks our heart that we can't see right now.
And if you're already being seen by a retinal specialist, even though it's been a year, you call them directly, and they, even if it's been a little bit past a year, they will be hopefully understanding of the situation and take you in without having the referral of the GP. Because in order to see the ophthalmologist, you do need to see your GP first, or at least have a call from them or a letter. Because unfortunately, we can't provide that letter, but we can give you the names of who to see. And that way your GP will know how to better direct you.
Thank you so much, Dr. Tashira. Thank you so much, Dr. Ramesh, for that. We are coming to an end of our session. Maisha, any other last questions?
Yeah, we have two last comments. I will combine them. So this one's from Facebook. It's a comment that people in governments need to think like normal human beings with average IQ to see that eye care and dental care should definitely be a part of universal health care. And this comment is from Richard Sari on YouTube, who asked, what can the NDP do to fix the problem?
Thank you, Richard. And 100% to both of you, I appreciate the sentiment. And I think, let me just say, I think we have to raise the bar a little bit higher for politicians, including, hey, like you can keep me, like hold me accountable, hold all the other politicians accountable. That's what we need to do. It's, for every profession, we have to do better when we really focus on accountability and make sure that we are really standing up for our neighbors, our constituents who elected us. And right now, we just need to remind the government of that. So our office has been contacted by hundreds of people from Scarborough Southwest. Many of you who are here today, many of you who joined our Facebook as well as on our Zoom session in the room. have talked about your personal stories and how it has affected your lives, and how is in the interruption of the eye exams and what it means for your kids, for example. So we've heard from many seniors with pre-existing conditions as well, who now cannot drive because they haven't gotten their eye exam. So it's really affecting their day-to-day lives as well. And a lot of your eyesight's getting worse. And I'm really worried about the fact that you can't get a prescription. So many stories are coming in, and please feel free to continue to send us those, because I will be sharing them in the legislature when I'm back next week. And for all of you who are comfortable sharing your story publicly, or being able to let us know if you want us to talk about what your kids are going through, please do continue to write to us. We want to continue this fight. So I want to remind us of the asks that the OAO has been calling on. And Dr. Teixeira, Dr. Ramesh, please feel free to add anything to this as well. So we have made two asks, which is the government agrees to cover the complete overhead costs that's required, which means 65% increase in funding is needed. And the second ask is that Premier and the Healthcare Minister, Minister Elliott, must come back to the table and commit to paying at least the operating cost to provide eye care services. Dr. Ramesh, Dr. Teixeira, I want to hand it off to you to make some final remarks and anything else that you want to add.
I think that's all we actually do want. And as to, I'm not sure who said it, is, yeah, if everyone could just remember what being human is about. And if we somehow get the entire Conservative government in here for just one day and experience each of them, what it's like to not drive for one day, or what it's like to not see for one day, or what it's like to have one eye, just so they could really feel what it's like to be human. And for all of you, the only thing you can do is the pressure is in the numbers. So continue to send your stories to Dolly, but continue to send your stories. If you are on social media, tag Christine Elliott. I mean, make these known and make it known to your Conservative MPP, or your Conservative, whatever they call them, not the MPP, because that's who you are. You know what I mean?
The MPP ministers, yeah.
Okay, yeah, the Conservatives, because that's the government we want pushed onto understanding what we're doing. So really, it's really making your voice heard. And a lot of people will always sit back and think, oh, well, someone else is going to do it. And you have to remember, no one else is going to make a change, but you're the only person that can actually make a change. So call them, call Dolly, send your stories, do whatever you need. And thank you.
Thank you so much. Dr. Teixeira?
I agree everything that Dr. Ramesh said. I think if anyone wants more information, I think we've tried to do a good job of covering everything today. And Dolly, thank you so much for holding this conversation today. I think it was really important for a lot of things to be clarified. But saveeyecare.ca, I believe, is a good resource for a lot of people. And there's, I believe you can send a letter to your or MPP through there. But I think what Dr. Ramesh said, if you have social media of any sorts, I would definitely tag your minister on that, tag Christine Elliott, tag the Ford government, and just try and get things known. Judith said earlier, there's strength in numbers. So the more we can do, the better.
Yeah. And thank you both for taking the time to do this and for continuing the fight. We will continue, like I said, with the petitions, with the letter. So we have already written to the Minister of Health, Minister Elliott, about this now multiple times, and we will continue to raise this in the legislature next week. And of course, all of you who are sharing your stories, please continue to do that. We'll make sure that we post a link again to the petition that's available for you to sign. And to all of you who joined us on live on the Zoom call, thank you very, very much. This is such an important fight, and we will continue to do this until we get the results that we need. And to your question, Richard, we agree with the OAO. We agree with all our constituents who are waiting for their eye exams because an NDP government would have already negotiated before it hit the deadline. We would have taken the time during the summer when the OAO came forward and said, here is what we need to do. And we would have not let let us get here. So absolutely, we're 100% with them, just like we stood.
And I can vouch for that. because I did call you and you did background work for me and found out some details and I was very thankful.
Thank you very, very much. And we'll continue to do that. And I know the government is able to give and to be able to invest in the eye care that's necessary, because right now they're still holding on to COVID funding. So if you need to invest, if you need to be able to do, good math, to do the right type
0.2%, 0.2%.
You can make that investment. It's not much. They're just asking for the bare minimum. So thank you, all of you. Have a good night, and please follow us on social media and share with us any questions or comments that you have. And feel free to always reach out to our office for anything that you need provincial. We'll be happy to support and fight for you in the Ontario Legislature. Thank you.